That was the first pandemic that we had with the internet, and now that, you know, in 2020, given the access that everybody has to the internet, there is so much information that is available and incredibly rapidly. On the positive, there's an incredible amount of science that is happening, and research studies and collaboration that is happening at an unprecedented space. And the global community has come together in solidarity to really harness that knowledge to put it towards the response and to evolve as the pandemic evolves, the response evolves, and that is incredibly positive. And we're seeing wonderful solidarity across all countries, across all sectors, in all different technical fields to use that to help save lives and break chains of transmission. On the other hand, we have an incredible amount of information and misinformation and myths and disinformation that is very difficult for all of us to handle. Our brains are not set up to receive so much information so quickly and to receive false information. And so we've worked really hard with many partners across the globe to fight the infodemic, to ensure that people have access to good information. We're working with tech companies to ensure that people can find that good information. We're working with businesses and different types of sectors. We're working with religious leaders. We're working with youth groups. We're working with individuals, you know, to be able to provide and share good information so that you know what you can do. It is really important. I think the impacts on not only physical health but mental health are incredibly challenging right now. Everyone is feeling the fatigue of this pandemic, but we have a long way to go. We need to remain focused. We need to remain strong. We need to accept that this is challenging, but use these challenges to really put it towards something positive and fight this pandemic together. And so we will continue to do that. And I think, for me, to say that this is a once in a century, I hope so. I hope we will never see something like this again. But we also must use this as an opportunity to build back stronger, to build back better, to have our public health infrastructure in place, enhance it, and in many places build it, so that we have surveillance in place. We have a public health workforce in place. We have health workers who are trained, who have the right equipment, who have PPE, to ensure that we have supplies that can protect frontline workers, to protect all of us. Again, we need to use this as an opportunity to build back better. And so if this does happen again, that we are in a much better position to be able to tackle it.
Thank you very much all for this very full and comprehensive